In our places of work, we make many choices. The choices we make are governed by our training, our resources, and our own moral and ethical compass. Some of these may be as simple as deciding whether we allow 3 visitors into a patient room instead of the allotted 2, or participating in ending the life of a patient who has requested medically assisted dying. Medically assisted dying, or MAID, is a topic of much controversy. Becoming legal in Canada in 2016, MAID has been a method that patients can choose in deciding how to tackle their illness. Mandatory participation in medically assisted dying on palliative floors has been the topic of debate between me and my colleague. It is my firm belief that MAID should not be mandatory for nurses working in palliative care floors. First of all, mandatory participation in MAID is not ethically supported. Many nursing associations have code of ethics prohibiting nurses from participating in procedures that take life. While it may be legal in Canada for this to happen, many in nursing believe in the healing and preservation of life. Many nurses consider a patient dying as a professional failure. Within the mandate of palliative care, MAID does not have a place. According to the Canadian Society of Palliative Care Physicians, palliative care is to reduce suffering, and this is done by providing effective pain management and interventions to help people live as well as they can until their natural death. While it may be argued that palliative care is where the majority of MAID is carried out, this occurs due to a systems issue. Palliative care physicians do not agree with MAID being carried out in their practice environments, and 75% of palliative care physicians have this opinion. An additional care delivery system should be in place, separate from the palliative care environment, to provide MAID for Canadians. Nurses have the right for conscientious objection. This is a provision that was made possible in the same policy that legalized MAID. Just as the autonomy and the wishes of the patient is to be respected, so then too are the moral and ethical beliefs of the nurse as well. Forcing a nurse to participate in MAID against their wishes would be a traumatizing experience, leading many to leave the profession. Nurses working in palliative care environments work with patients to live as well as they can until their natural death comes. They should have the right to refuse to participate in a procedure that goes against their own personal and moral beliefs, and that is not congruent with the type of care they were hired to perform. Today, we live in a time where medical advancements are occurring at a fast pace, and these challenge legal and moral convention. Disregarding the right of the nurse to refuse to provide care based on the objections and the environment in which they provide this care is a dangerous path to take. We must ask ourselves, does mandatory participation in MAID promote the best interests of the nursing profession, or is it the gateway to a slippery slope leading to many unknown and dangerous consequences?